Hello, everyone. Welcome back. We are reading the Nursing Care, the Basics book by Hartman. Because now that we're working in healthcare, we're continuing on with chapter 1. This is part 3, the last part of this chapter. It's going to be chapter 1, section 7 for the nursing assistant and long-term care. So now we're going to talk about
The nursing care.
list examples of legal and ethical behavior and explain residents' rights.
Where am I at? Okay, number 7. List examples of legal and ethical behaviors and explain to residents' rights. Ethicals and laws guides behaviors. Ethics are the knowledge of rights and wrong. And ethicals, persons has a sense of duties towards others. He tries to do what is right. Laws are the rules set by the government to help people live peacefully together and to ensure orders and safeties. Ethics and laws are very important in healthcare. They protect people from receiving cares and guide people's giving care. Nurse assistants and all care teams members should be guided by the code of ethics. They must know the law apply to their job. Guidelines, legals and ethical behaviors. Be honest at all times. Protect residents' privacies and confidentialities. Do not discuss their cases except with other members of their care team. Keep staff information confidential. Report abuse and suspected abuse of residents. Help residents report abuses if they wish to make a complaint about abuse. Follow the care plan and assignments. If you make a mistake, report it promptly. Do not perform any task outside your scope of practice. Report all residents' observations and incidents to the nurse. Documents accurately and promptly. Follow rules for safety and infections prevention. See Chapter 2. Do not accept gifts or tips. Figure 1 through 10. Do not get personal or sexualities involved. With residents or their family members or friends. Okay. Okay, your turn. Clearly understood. Wait, well, how far are you now?
Okay, so the Omnibus Budget Reconciliation Act (OBRA) was passed in 1987 when I was born. It has been updated several times since. OBRA was passed in the response to a report of the poor care and abuse in long-term care facilities. Congress decided to set minimum care standards, which include standardized training of nursing assistants. OBRA requires the Nursing Aid Training and Competency Evaluation Program (NATCEP) set minimum standards for nursing assistants. NAs must complete at least 75 hours of training that covers topics such as communication, preventing infections, safety, emergency procedures, and promoting residents' independence and legal rights. Training must also include basic nursing skills, personal care, and how they observe and report changes in residents' conditions. NAs must also know how to respond to mental health and social services, rehabilitative needs, and how they take care of residents who are cognitively impaired. Like hula. OBRA requires that NAs pass away competency evaluation, a test, before they can be employed. NAs must also attend a minimum of 12 hours per year in-service education, keep their skills updated. That's the thing I was telling you about, the thing you do online. You started on that one class? The one you said you already signed in?
Which one is that?
The talks over here, the continuing education, 12 hours per year. The thing you said you're going to sign on to.
MedTech?
No, the thing you said you're going to do online when I told you to do it because it expires in like 30 days. You got to do that class.
Volunteer?
Pick a picture of it on your phone with that password stuff. You got into the computer.
Okay, yes.
Did you start on that class?
Reliance.
Did you start on that one class, the first class?
Brenda just showed me.
Just do in like 30 days for like a couple of them.
Yes, she
One
said
of them's
you
due
don't have to rush.
one of them's due on November 26th. 6 days from now. And then are you also doing your counseling?
I tried to do it, but I couldn't get in there.
What, on the computer?
On my phone.
Are you gonna try doing it on the computer?
Yes, but everybody's always hogging the computer.
Why didn't you get on your phone with it?
Because it's a computer thing that you can't look at your phone. You know?
Yeah, but
You have to use a computer,
yeah,
computer
how
or
am I gonna
laptop to
access
look
it
at
on
it.
my phone?
Yes, but I'm talking about if you're taking like the quizzes.
No, I could do it on my phone too. I'll show you. Resident assessment requires another important part of OBRA. OBRA requires that complete assessments can be done without a resident. The assessment forms are the same of every facility. OBRA require major changes in the survey process. Surveys also are inspections to help make long-term facilities follow state and federal regulations. Surveys are done periodically by the state agency of the licensed facilities. They may also be done by the facility that has been cited for the problems. The site means the documented problem to survey inspections may be done less than the facility may have as a good record. Inspection teams includes a variety of trained healthcare professionals. The results from surveys are also available to the public and posted in the facility. OBRA is also identifying important rights for residents. Long-term care facilities. Resident rights, specifically how residents may be treated while living in a facility. They may provide an ethical code of conduct for healthcare workers. Facility staff give residents a list of rights and review each right with them. In 2016, Centers for Medicare and Medicaid Services finalized a rule of improved care and safety of each residents in long-term care facilities. It was the first comprehensive update since 1991. It includes the strengthening of the rights of residents to live in long-term care facilities. NAs must be familiar with these legal rights. Residents' rights including the following. Quality of life. Residents have a right to the best care available. Dignity, choice, independence are important parts of quality of life. The facility must give equal access to quality care, regardless of residents' conditions, diagnosis, or payment source. Services and activities maintain a high level of wellness. Residents must receive the correct care. Healthcare professionals and facilities must develop a care plan for residents. This care should be kept in the healthiest way as possible. A baseline care plan is residents, which includes instructions of providing person-centered care, must develop in the 48 hours of admission. Residents' health does not decline as a direct result of a facility care. The rights to fully inform about resident rights and services. Residents must also be told that services are offered, what the fee is for each service. They must be informed of charges both orally and writing. Residents must be given a written copy of the legal rights along with the facility's rules. Okay.